when we talk about challenging cases, I like to think that every person that comes to see me is so unique to themselves, and every person is a challenge, and in that it's like being a little detective trying to figure out, well, where is that really coming from? You know, where is that disharmony? Because again, it's a very expansive view of medicine. Could it be in the body? Is it something they're eating? Is it lack of exercise? Is it an old trauma from childhood? What is really creating that disease or disharmony in this present moment? So I like to think of everyone as really individual and complex and unique in regards to that. But when it comes to conditions that are difficult to treat, I would say cancer, certainly. I spent 5 years working with cancer. I was given $1 million grant to actually look and travel the world and research natural or just find the cure for cancer. It was a really amazing journey. I went to Mexico and Russia and Ireland, Germany, the US, very many places, worked with wonderful doctors, medical doctors, naturopathic doctors, different healers. So cancer takes everything that I have, every skill that I have, because when people come in, sometimes we have to work with a physical body. The physical body's been really stressed, oftentimes with radiation or chemotherapy. So we have to rebuild the body, really, in essence, to detoxify and rebuild. And that can take some work. And then at the same time, oftentimes there's a real emotional burden to that. I have to work with their mind and emotions in such a way that we can release any tension or distress that may be caused by just the trauma of going through the whole experience. Spiritually, people become amazingly spiritual in times of high crisis and with illnesses that are so life-threatening. So oftentimes I'm working with people on a spiritual level, and we have deep conversations about what their connection to God or spirit or essence is, or creator. And that's really important in helping people to take that journey and find out what that is. So yes, a life-threatening disease like cancer takes everything that I have, every skill that I have, to help them find peace and health and healing with something like that. And I help people with cancer in a couple of different ways. One is that we'll help people to move through chemotherapy and radiation, and with really safe therapies that really augment those therapies. I also really, really love to see people after they've finished radiation and chemotherapy, because then I can help them to rebuild, and we can prevent, people who have cancer are at a high risk for it coming back, not only because of the therapies, but also because they've had cancer. So there are many ways that I help people with cancer. One is to help detoxify their body. We do drainage techniques, homeopathy, lots of cleansing and detoxification. I give IV therapies of high-dose vitamin C, kerosene, Laetrile, Ukraine. There's all sorts of different therapies out there. Lots of processing therapies. We do journey work, holographic memory resolution, breath work, meditation practices, yogic practices. I chose to treat cancer because it's a very difficult disease to treat, and working with people who have cancer forced me to grow and be the best that I could be. Often I'm known in where I work as being the doctor that takes on the really difficult cases. And I love the challenge of that, and it would push and stretch me and cause me to grow in so many ways. And I have to thank every one of those people that honored me with coming to actually work with me, because they taught me as much as I'm sure I helped them. So I've had remarkable cases when it comes to treating cancer. I've had people that came in with 2 weeks to live that are alive today, and I've had people come in that I expected would live for a long time that have passed away. And I realized that, it really is in God's hands as to a person's life, and it taught me to surrender a lot and really listen to people. started to have a focus on mood disorders near the end of my research with cancer therapies. There's a clinic in Venezuela that focuses on balancing brain chemistry and using that to treat cancer, and they're actually having quite remarkable results in helping clients go into remission. And that was fascinating, truly fascinating to think how we can affect the brain and it can affect something in the body like that. So I started to research neurotransmitters, hormones, brain chemistry, and clients started to come to visit me. And I started treating bipolar, schizophrenia, chronic depression, anxiety, and was having remarkable success, helping people balance their moods, sometimes with drug therapy, and sometimes helping them to get off of drug therapy and do it completely on their own. And we did that, I did that by again using the model of, integrative medicine, which is physical, mental, emotional, spiritual, and environment. So I would balance their brain chemistry, their hormones, their thyroid gland, their adrenal glands, get their digestive system working better. And at the same time, we would look at what programs were acting out, what mental, emotional traumas were manifesting through their physical bodies, and people were just getting better.